Hey, good afternoon, everybody. My name is Dr. Brian Hadeed. I'm a general dentist in Clinton Township, Michigan. It's April 29th, 2020. This is my first video, probably in about a month. And we're still shut down, as you know, at being a general dentist. And really, we can't see any patients except for the rare emergency, real emergency. I'm not talking like a chipped tooth or anything, or even a lost filling. I'm talking about swelling and severe pain. And even then, if we can take care of the situation with antibiotics, short term at least, that's the preferable method of treatment for now. Again, but that gets to be a dicey situation too. So don't take that with, nothing set in stone, but generally speaking, that's the general idea. Okay. At that point, it's more of a discretionary thing. Okay, so enough about that. I'm really making this video because I want to update everybody about our plans to reopen in a safe way given the COVID-19 situation. I anticipate the governor allowing dental practices to open, but we're going to have to do it in a different way. We're not going to be, it's clear, no one's mandated this, but it's clear to me that, for the next 8 months, maybe the next year after we open, let's say in 6 months from now or 6 weeks from now, we're going to have to follow a different protocol to keep patients safe, as well as ourselves as safe as we can be. Here are my thoughts about that. Number one, when we schedule you and confirm your appointment, we will be asking some questions. Again, nothing's set in stone. I just want to say this. Nothing's set in stone, but these are some preliminary thoughts. We're going to ask you some preliminary health questions, some travel questions. Have you traveled to a COVID-19 hotspot? Are you experiencing any symptoms? And we, ask some questions. And then when the patient comes in, we're going to have all our patients wear something over their face, like a cloth mask or a regular surgical mask. All patients will be required to use hand sanitizer before as they're coming into the office. Okay. That being said, I also want to really strictly limit the amount of patients in the office at any one time. Obviously, we want to keep everybody's distance at least 6 feet. So that means for me, I'm going to have to schedule more time for patients. Something that might take me a half hour, I might schedule 45 minutes now. Why? Because I just want to make sure I get my patient out the door before the next one actually walks in. And we're going to have to kind of stagger things. So I just want patients to know that things will go a little slower in the office. We're not going to be able to see everybody all at once, so to speak, like we did before. Now, that's my opinion, and obviously we'll get more guidance on these things, but that's how things are looking. There's not going to be much more. There's not going to be more we're going to do. There's not going to be, unless I get some other clarification, some other guidance that I'm unaware of. There's nothing more that we're going to do to our dental operatories per se after a patient leaves. We're still going to disinfect everything, all surfaces, with medical grade disinfectant like we always have. And the big thing is just, I think, scheduling here. We're going to have more time in between patients. I don't want multiple patients waiting in the waiting room. One other option we're going to do, or probably employees, having patients just wait in their car if they have a cell phone, which 95% of it, 99% of the patients do. We'll say, listen, bring your cell phone, sit in the car. We'll call you right when we want you in. So that way no one has to sit in the waiting room with other patients. Even though I want them to wear masks as much as possible. Obviously, you can't wear a mask when we're working on you, but while you're sitting, if you are in the waiting room or just walking back to the operatory, we're going to have you wear the mask. And so these are my preliminary thoughts. We are investigating heavily some devices that have been touted to be able to disinfect the air or clean the air. Negative pressure rooms, you hear of these things in hospital type settings for certain infectious diseases. In the dental setting, I really question how possible that is. Maybe if we had an overhaul of all dental offices on the planet, or at least in the state of Michigan or in the United States, and that might take a decade to get all the dental offices to have negative pressure situations. I don't even know if that's feasible. Anyway, so, but there are other solutions, supposedly, at least being advertised to me as potential solutions, I should say. So I'm investigating those, and I'll likely report back to everybody about that at a later time. That being said, there's another thing I want everybody to consider, and that is, we want to reduce the level of virus particles in the air. That means I have to reduce aerosol generating procedures. Anybody who's ever had any work done knows that we use this dental drill, and its mists shoots air and water out the front of it. So that's not really what we want. So we're gonna have to limit the use of any aerosol generating thing, and that is right off the top of my head, we're gonna really look at, and I haven't made an official decision yet, but the use of ultrasonic or Cavitron cleaners. So when you get your teeth cleaned, we can clean your teeth without those devices. For the time being, we may have to put those on the shelf. Again, still looking into that as well. But these are my gut feelings right now. And another thing I want everybody to know is there are some products out there, some pieces of equipment out there that can be used to suction up the aerosols so that we reduce how much of that gets put into the local atmosphere, if you will. I'm investigating those products as well. So I just wanted to keep everybody posted about the situation. There are other things that I probably didn't mention that we plan on doing. I don't think I mentioned taking a patient's temperature when they come into the office or when they sit down into the operatory. Probably will do it when they come into the office, record that in their digital chart. There's a little, along with that will be a little ADA, a little questionnaire that the American Dental Association has developed, which seems to be a nice, if you will, a nice set of questions just to help assess a patient's risk level for having COVID-19. And we'll again have the patient do that. We'll ask that patient those questions, and we'll record it and put it into their digital chart as well. And that's all for now. Again, we're still formulating plans, but I just want to let everybody know that we are thinking about these things. We will open in the safest way we can, and that's all. Everybody have a good day. My kids want me to tell everybody or ask everybody to like this video, subscribe to my YouTube channel, and find me on TikTok. If you want to see some funny videos, you got to watch those. You probably don't have too much to do right now anyway, so might as well. All right, everybody, have a good day. Bye-bye.